Hello, everyone. My name is Dr. Yusof. I'm a consultant rheumatologist from Leeds, United Kingdom. I'm reporting for Room Now to cover the EULAR 2025 Congress in Barcelona, Spain. As we all know, glucocorticoid is like a friend or a foe. It can help to reduce inflammation in patients with lupus quickly, but also in the long term, unfortunately, it's giving a lot of side effects and also can lead to various comorbidities and also potentially mortality. So there's various guidelines, EULAR, ACR, and etc., all wanting for patients to be on the lowest possible maintenance dose of steroid or perhaps cessation of steroids during the therapy. However, there has been lacking protocol to standardize how should we reduce the glucocorticoids. So this is very timely, and a group of rheumatologists, nephrologists, dermatologists, and general internal medicines. So all these people came together and then did some DELPHI, which involved a two-round and reach consensus on how to taper the glucocorticoid in a safely manner. So this was presented as a poster, POS 1224. Uh, so during the DELPHI rounds, they identified three main themes that they wanted to address. So the first one regarding general consideration of glucocorticoid tapering. Second one is managing flares and future risks of major flares and those at risk of flares during GC tapering. And the third one was managing glucocorticoid associated toxicity. Following two rounds of DELPHI, so they came out with eight protocols on how to reduce the glucocorticoids. So this would have covered patients with mild lupus, then patient with moderate lupus, patient with severe lupus plus active lupus nephritis, and also it also help advise and guides on patient who have been on long-term oral prednisolone and whether we can reduce the dose faster. So when we say faster, so it's around 3 months, and whether it can be reduced slower, so up to 6 months. So these are going to be helpful for all of us who are looking after a patient with lupus. So the protocol are quite self-explanatory, and perhaps we can use these protocols and put it in our clinic room so that we will not forget to start planning to taper the prednisolone in our patients. One thing that I'm a little bit puzzled was pertaining to testing for adrenal insufficiency. The group didn't have any consensus for it. I think this probably will rely on ourselves and our practice. So certainly for myself, if the patient has been on long-term prednisolone for quite some time, and once you reach the oral prednisolone about 5 milligram per day, I will usually perform some testing, such as a short synectin test, to see whether do they have any reserve to produce their own adrenal response, and if there is, then you can then taper safely, and if there's any other questions of the test become negative, as a positive, then you can also liaise with endocrinologists to get some more further advice. So I think this is really a good move by this international group to produce this regimen and for us to use. And I hope once this is published, the uptake will be implemented hopefully globally, so that we can plan to taper the glucocorticoid safely to our patient, and also to improve the long-term outcomes of our patient with lupus. I hope you find the summary useful, and please follow me and also Room Now at various media outlets, including YouTube, Twitter, for more content coverage. Thank you.